area. Of course, Dr. Jason Salemi, we've gotten to know him very well during the pandemic, and thank goodness he has been a local resource for all of us. We trust the folks at USF Health and thank them for taking care of folks all across our community day in and day out. But Dr. Salemi's COVID tracking project and his epidemiological analysis of the pandemic since the early days has been invaluable to helping to keep our neighbors safe and provide the best up-to-date health data. So thank you, Dr. Salemi, for being here. And then Dr. Christina Kennedy, who is head of pediatrics at Bay Care. She is board certified from the American Academy of Pediatrics and also a graduate of USF College of Medicine. And I can vouch for her personally. She was my daughter's pediatrician when they were in their teen years, adolescent years, and they're healthy and well. So I think we all come at this as parents as well, with Dr. Salemi being the dad of a young child, and Dr. Kennedy having teenage kids, and my daughters are both still in school and college. So we want to provide the best information to parents out there. But what spurred me on this morning is the fact that, for many years I've worked hand in hand with America's children's hospitals, particularly St. Joseph's Children's Hospital here. That is one of the premier health centers for children with complex medical needs in the country. We also benefit in the Tampa Bay area from Johns Hopkins, all children's, and then have the top leading children's hospitals right here in Florida, in Jacksonville, Orlando, and Miami. And what got my attention Sunday was a full-page ad in the New York Times signed by 220 children's hospitals from across America, imploring everyone to help stem the surge of young COVID-19 patients. America's children's hospitals are under an unprecedented strain. And I was shocked to see this full-page ad that included a plea from St. Joseph's Children's Hospitals, Johns Hopkins, all children's, and all of the other children's hospitals in our state. Pediatric hospitals are at or near capacity, and they expect to see more child patients as schools continue to open across the country. And other complicating factors include they're seeing more children with serious mental and behavioral health issues, in part because of the social isolation they experienced last year and the general devastation brought by the pandemic. Here's what their message said: protect our children. Children's hospitals are on the front line of care for kids, anchoring the pediatric safety net for the most vulnerable among us. Tragically, rising numbers of COVID-19 infections among children, surging cases of respiratory illness such as RSV, and the pandemic's ongoing impact on mental health are pushing our children's hospitals to capacity. Combined with significant hospital workforce shortages, the pediatric safety net for all children is being threatened in unprecedented ways. And we call on leaders in the public and private sectors and the American public to stand with us to help protect our children. All eligible populations should be vaccinated. Everyone should mask responsibly, particularly during school and while attending large gatherings, and all should adhere to proven safe practices of social distancing and hand washing. Together, we can keep our children safer. They need our support, our care, our commitment to the future, and they need it now. That sure brought it home to me, and we really need to help communicate this to parents, educators, everyone across our community. So I'm going to turn now to one of those great communicators, and Dr. Salemi, thank you for being here. Welcome, and I'm very interested in your presentation this morning.
Thank you so much, Congresswoman Castor. As always, I feel like a discussion like this really needs to begin with the evidence base and where we are. So I will be very, very brief with this presentation, but hopefully it will give everybody a baseline understanding of exactly where we are in recent history. And so this is something that should not look foreign to anybody. This is our epidemic curve. So this is data from the Florida Department of Health, the number of weekly cases throughout the pandemic. And you can see our summer surge of 2020, our winter surge, and now more recently, the Delta surge. And so obviously you saw this very pronounced rise. But what's been nice is in just the past couple of weeks, we have finally started to plateau. The rise seems to be at least seeding for a little while. Unfortunately, it's stopping at a very high level where we're still experiencing over 20,000 cases each day. And as is almost always the case in epidemiology, if you dig deeper, the story is not the same for everybody. So again, this is just pointing out over the past 8 weeks, just focus on what's in the red box. This is the average daily number of cases over the most recent 7-day window. And so again, we were increasing dramatically all the way up to a high of just over 21,000 cases per day. And now we're starting to dip back down below that. And so what this is this shows the recent curves for every single age group. And I'll save you from having to look at all of these curves. But what you should notice is that most of the adult age groups, the one that I'm hovering over here, you see a turn. We're actually starting to see a decrease in the number of daily cases in all adult age groups over the past 2 weeks. And what you see there are the percent changes in each of those age groups. So again, it's wonderful to hear that we have 7% fewer cases in the most recent weekly report compared to 2 weeks prior. But of course, the unfortunate part of all of this is the two age groups that have seen pronounced increases in the past 2 weeks has been our two youngest age groups, the 12 to 19-year-old group, and then of course the age group younger than 12 who cannot be protected by a COVID-19 vaccine. This should not be shocking to anybody with kids going back to school in full capacity, but of course, this is what we're experiencing right now. It's not just cases. I also like to focus on indicators of severe illness. And so these are hospitalization rates by age group. And again, the story is very similar. If you look, you could see that pronounced increase in hospitalization rates that we've experienced since the end of June, early July. But you can see a lot of these for the older age groups. This top one is 80 plus years old. You can see them all starting to turn the corner. So the news is, again, this is at a very high number. We still have over 1,700 adults being hospitalized every day with confirmed COVID-19. That's not a number any of us likes to see, but at least we are starting to turn the corner. Unfortunately, the story, just like with cases, I do point out this graph to show that the likelihood of a child being hospitalized with COVID-19 is far lower than an adult being hospitalized with COVID-19, but we are continuing to see a rise in hospitalizations in the pediatric population. And again, if you look back 9 or 10 weeks ago, we had about 6 children being hospitalized every day in the entire state with COVID-19. We've had a 10-fold increase where more recently, over the past 7 days, it's been about 66 children being hospitalized every day with confirmed COVID-19. On the vaccine front, again, we're making slow but steady progress in terms of getting people vaccinated. One of the things I don't think that you'll be able to see very well because the graph is pretty small, but actually our youngest age group, the 12 to 19-year-olds, have been increasing the most in terms of their vaccination rate, so much so that they now have a higher vaccination rate than those individuals 20 to 29 years of age. But again, you can see the differences in vaccination rates. 48% is the lowest that we have in the 20 to 29-year-olds. The average over everybody is 68% of Floridians that have at least one dose of a COVID-19 vaccine. And then, of course, the highest rates are in our 65 and older population. Almost 9 in 10 of them have gotten at least one dose of a COVID-19 vaccine. And then the gray area curve kind of in the back here, we had fallen off quite a bit. We were administering a lot fewer doses on a weekly basis. But I think when the numbers started to increase, that drove more and more people, which is a good thing, to go out and get vaccinated. And so we're still not where we want to be with weekly number of doses administered, but we are at least improving relative to where we were about a month ago. And again, why that's so important is when you think of the most vulnerable people in our communities, by and large, those are people who are not fully protected through vaccination. And again, I just want you to focus not on all of these numbers, but down at the bottom right in the red box. These are the estimated numbers of people in Florida who are still not fully vaccinated. That includes almost 1 million people 12 to 17 years of age, over 5.5 million people who are 18 to 64, and there are still almost 800,000 seniors in Florida who have yet to be fully vaccinated. And of course, we can't forget about the 2.8 million children in Florida who are younger than 12 and as of yet cannot be protected through a COVID-19 vaccine. There is some really good news in what the vaccines have done. I don't think this is foreign to anybody, but the bottom left graph here, what it's basically telling you is that we've shifted the age distribution of hospitalized patients to younger ages. And so whereas back in January, 1 in every 2 patients being hospitalized was 70 years of age or older, now it's more like 3 in 10, which is a good thing because the older people are, the more likely they are to have really serious outcomes, including death. And even on the bottom right, the good news is we're also shifting the age distribution of people who are dying. Again, older people age 65 or older were 80% of all COVID-19 deaths. Now they make up about 63, 64%. So those are all good things because the most heavily vaccinated group in our societies are seniors, and they are realizing the benefits of vaccination more than any other group. But the unfortunate thing is, as I'm sure everybody's starting to pay attention to, is, we saw record numbers of cases, record numbers of hospitalizations, even in the older age groups, and despite the vaccine, but we weren't seeing those deaths increase until recently. And so this is just showing you the average daily deaths per day during the summer surge of 2020. We had gotten as high as 228 people dying each day. In the winter surge, it was 201. And based on the most recent data, we're now already at 221 per day. I'm going to anticipate today we're going to get a daily dump of data that's updated from the Florida Department of Health. I would actually be surprised if we didn't see the numbers at or above the summer surge of 2020. So unfortunately, we're starting to see the death numbers rise. And the last thing I'll leave everybody with is, and I know we have a lot of media here. I just happened to pick Bay News 9 because I happened on their site. Most of the local media stations are doing something akin to this, is showing us the impact in our counties and in our school districts. And this just shows you that based on information a day or two ago, there were over 17,000 cases just in our local 7-county, you can call it a catchment area that you see highlighted in red down at the bottom. And of course, you can even see the Hillsborough County dashboard. The numbers are already higher. And that's just number of cases. They also estimate the massive numbers of children and parents and everybody who is being impacted by quarantining and isolation that is associated with transmission, not just in schools, but in our communities. So again, I know that was quick, but that's kind of a snapshot of where we are with COVID-19. And with that, I'll go ahead and stop sharing my screen and turn it back over to the Congresswoman.
Yeah, thank you, Dr. Salemi. Very interesting numbers. I know we're going to have a lot of questions about your data, but thank you very much. That was a very important place to start. Now I'd like to go to Dr. Christina Kennedy, with the head of pediatrics at Baycare Health System. Welcome.
Thank you, Congresswoman Castor, and thank you, Dr. Salemi, for the lead-in, because the data is really important and helps to educate so many people on what's really happening and keep things in stride. As Congresswoman Castor introduced me, I'm the Pediatric Service Line Medical Director, which oversees quality for Baycare for pediatrics for all of our hospitals and facilities. I also am a practicing pediatrician for the last 20 years. So I've had my boots on the ground and been taking care of many of these patients as well, and see it from both sides in addition to being a parent. One of the things that I want to stress is that although we have seen a tremendous increase in pediatric admissions to the hospital, in general, kids still have a less complicated course and death rates remain low. That being said, the pediatric population in the hospital still makes up 1.5% to 2% of those patients. And because the adult numbers are so high right now, we see that as well in the pediatric population. We have seen a little bit of increase in severity, and what makes it a little bit more difficult to navigate is traditionally a lot of our pediatric staff were transitioned to taking care of adults because there were so many adult COVID patients in the hospital, but we've seen those numbers as well. So within our health system, we've actually seen a triple in our admissions during the month of August. It was our highest month by far, and we had 180 pediatric admissions to all of our facilities. The majority of those are cared for at St. Joseph's Children's Hospital. We have seen an uptick in our emergency room visits, And in general, we still have capacity, but with the adults having so many more admissions, it puts everybody at a strain. We see as we opened the school year, it was truly what I call the perfect storm. Last year when we opened, we had mandate mask requirements. We had some of the lowest rates of infectivity, positivity, and prevalence that we had seen during the pandemic. But this year we were at absolute opposite ends of the spectrum. We were at very high prevalence and positivity rates, and we've continued to see a large number of children impacted. One of the most important things that was relayed, not only by local professionals, but by our larger organizations, such as the American Academy of Pediatrics, was the importance of keeping kids in school. And you can look at all those websites and see on a daily basis, there's up to 10,000 children who are being impacted by not being able to attend. Not only that, you have parents missing work, you have younger siblings who aren't part of the school district, and we know those hospitalization rates are much higher for older teenagers and for kids under the age of 4. The real tragedy here is that we're seeing extreme behavioral health issues as a result of isolation from the early starts of the pandemic, communication because younger children didn't have that kind of socialization when they were first born into this world. And now we're also experiencing a lot of families who have had loss, either the death or morbidity of a family member or a close friend because of the pandemic. So it's affected us all in so many different ways. I know there are many media reports out there right now about healthcare workers that are exhausted. And I feel like in Florida, we had the benefit of not seeing our peak surge to date until this point in the pandemic, simply because in other parts of the country, they weren't prepared for that kind of surge, especially in New England during the early parts of the pandemic. We were able to mobilize, get resources in place, have ventilators in place, ECMO machines in place, have the staff to deal with it, in addition to being able to pull in a community and pool of resources and having a wonderful team member strategy within our health system where people could assist wherever needed. And that could even include members of our executive leadership team who help with patient care, delivering meals, patient transport. And that's been really important that we've all worked together. So I think if anything, educating everybody about the seriousness of this, that it's going to continue to circulate as long as it continues to be transmitted. And most pandemics last on average 3 years. I know we don't have a lot of experience with this because it's been over 100 years since anybody experienced it. And most of those are no longer with us. So we're learning as we go along, and this is truly our first pandemic and a first world of the modern era that we've been dealing with. So the education remains steadfast. Number one, get your vaccination if you're eligible. Number two, wear a face mask. It's more important that a person who is infected wears one, but if you wear one as well, you can decrease your risk of being exposed to the virus. Practice good hand hygiene. Make sure for little kids, we try to encourage them to keep their hands to themselves and keep their things to themselves, and also to wash their hands frequently. And then the other one is stay home if you're not feeling well. So many people think that COVID has certain traits and qualities such as loss of taste and smell. Those were true of the earlier strains of the virus, but anyone can tell you the Delta strain, the majority of the patients I've seen in my office truly come in with a scratchy throat, a little bit of congestion, a low-grade fever, and maybe just not feeling great. Some say, I think my allergies are acting up, and they're very surprised when their rapid test is positive, or when I say, hey, look, you're going to be in quarantine until we get your test results back. Whether you've had an exposure or not, we have to take every case seriously at this point in the pandemic. And last of all, I really encourage the education and everybody being socially responsible. We all have to take care of each other, and that's what the healthcare team and individuals have done throughout our communities. But it is a little defeating sometimes when people don't heed the message. And I can be honest with you that personally, I've had family members who have been affected by this virus. I know people personally who have passed away from this virus. And I can tell you more than anything that I have reached out to family members who are unvaccinated to tell them this is the one thing that could save your life. The majority of our patients in the hospital are unvaccinated, and the majority of the deaths we are seeing now are unvaccinated. So we just urge everybody to be educated, to take care of each other, and continue to protect those most vulnerable, especially those children who don't have access to vaccinations yet.
That was great, Dr. Kennedy. Thank you so much. And thank your entire team there at St. Joseph's Children's Hospital, too, for taking care of our most vulnerable neighbors. I know, Marcia, we want to go to questions, but I wanted to ask Dr. Salemi a quick question here. You showed that the rates of vaccination for the age group 12 to 19 and then 20 to 29 is about 20% lower than the average age in Florida. Who are those young people? Have you been able to drill down to see if they're what their ethnicities, race, location? Do you have a little more granular data on who those folks are who need to get vaccinated in that age range?
Yeah, boy, wouldn't that be lovely. I'm very good with data when I have the data to analyze. And although you see CDC compiling some national data and talking about racial and ethnic and socioeconomic disparities in vaccination rates across all age groups, we don't have that granular of information that's made publicly available. And so all that I can allude to is the likelihood that they're everywhere, and they're not just, you can't paint those people who are not fully vaccinated with a broad brush. It's not just people who have access to maybe some misleading information. It could be people that are just frightened. I have my own personal family members in that age range, even knowing what I do on a daily basis. They were terrified. I had a niece who thought that she was going to have reproductive issues if she were to get vaccinated, which of course, when you look at the evidence, is absolutely not true. I had a lot of people who, again, when you have people who are intentionally spreading disinformation, they don't have to convince you that the vaccine is dangerous. They just have to sow a seed of doubt. They have to make you question it and put you on the fence. And I think that is, largely consistent with a lot of people who are not fully vaccinated, but there are still people who, in older age groups as well. I mentioned that there's almost 800,000 seniors who aren't fully vaccinated, and they know that they're in high-risk groups. And I think that there's a lot of common themes that we see with them, like still problems with digital literacy, scanning a QR code, going on a website and signing up. I mean, I've heard countless, stories about that. They want to get vaccinated, but they don't know where to go. They don't know how to sign up. I know my parents would have been in that same situation if I didn't help them to sign up early on in the pandemic. So I think the reasons that people are not vaccinated are quite varied. It doesn't really do us much of a service or make a lot of progress to berate them or vilify them. They will bear the disproportionate brunt of what happens now with this current surge. They're much more likely to be hospitalized. They're much more likely to die. But I think we have to have those conversations, explain to them why we got vaccinated on our own, make sure they have access to reliable and accurate information. And I think that's the best way. We talk about this hyper-local response. Really know your communities, really know why people are not getting vaccinated, and then you can maybe start to make some headway. But I wish we had that data so that I could give you more granular information, because that would certainly enable our response to be more effective.
Thank you. Well, we're going to work on that. Okay, Marcia, I think we can open it up to questions. From Facebook, there are probably some parents out there who have questions, and then members of the press. I know we'll have a few.
Okay, yes, we do have some questions from the community. The first question is, why can't kids under 12 get the vaccine, and when do we think we can?
Yeah, so I'm happy to take a first stab at that. So, when we develop vaccines like this, you've probably heard a lot about these randomized clinical trials, where there is a lot of resources that are put into making sure that prior to authorizing this for the general public's use, we make sure that all vaccines are effective. And these vaccines for COVID-19, we're very blessed that they are very effective in doing it what they were designed to do, which is prevent severe illness and death from COVID-19. From that standpoint, they offer a substantial reduction in risk. And so, when we go through this, it's not just about the effectiveness. We also want to make sure that they are safe, that they're not causing adverse events. And so the reason that this was released for the age groups that it was is because they have been deemed safe and effective. Now, we are ongoing having studies, especially in children who are 5 to 11 years of age right now. And I would anticipate that as long as the data are demonstrating that they are also safe and effective for that age group, which so far it's looking promising, but they're not going to move forward until they get clear indications that they are safe and effective for that age group. And only at that time will they apply for emergency use authorization, and will we be able to then start vaccinating children in that age group. So it's always in science operating out of an abundance of caution and making sure that before we put needles in arms, especially of children, we make sure that it's going to do the job that we think it's going to do and with not any adverse events.
And if I could just add on to that a little bit, one of the things to keep in mind is the immune system does function differently. And the younger you are, in very young infants, their immune system is not quite as active, and then it builds up through life. So by the time you're a teenager, your immune system is pretty comparable to that of an adult. It does slow down a little bit more to an adult status as you get older in the teenage years. But in general, part of that is our vaccines, as they've been developed for different age ranges, sometimes they do get smaller doses. One of the exceptions to this is for a long time, young children received a lower dose of influenza vaccine. And it was deemed safe and effective at the lower dose, but after several years, what they realized is that kids could also have the regular dose, and it was just as effective and just as safe. But early on, they wanted to make sure they didn't push the boundaries. So in this vaccine, I completely agree with Dr. Salemi. We want to make sure that it's safe and effective. And in general, children still have lower hospitalization and extremely low death rates from COVID. But the burden of illness in general, they have a lot of secondary side effects that can happen. And we don't know long-term, are there other effects on their bodies? So we want to decrease those risks, but make sure the benefit's there and make sure it's safe and effective. So extending these trials in children is important to make sure that we're not causing any harm.
Okay, thank you. Next, we do have another question from the community, and then we do have some questions from the media in the queue, so we'll go to those after this one. What do we know about the long-term effects of COVID in children?
That's a great question. And actually, currently, it is being studied as far as long-haul COVID goes in children. I think there's also a lot of interest in behavioral health effects, because we had a lot of patients who actually displayed behavioral health symptoms and tested positive at the same time for COVID-19. And we don't know if those were truly brought on as a result of the illness, or if it just happened to be coincidence. So that's one thing that we have great concern about. Kids have also presented with a lot of other symptoms, including new onset seizures, irregular heart rhythms, and we call it the great masquerader right now. So in pediatrics, if you have a child that comes in that has a change in their baseline, we are investigating if COVID is part of that. So I don't have a lot of information yet. There have been some preliminary studies that have been released, but it's really in small numbers. So we hope to have more information on that and hope to continue to collect data, which is being done in many centers.
And I agree wholeheartedly with Dr. Kennedy. Obviously, she has boots on the ground. I agree that there's still a lot that we're learning. There's reason for concern, but a lot of the studies are very small. They don't offer you a lot that we can generalize. And so I imagine that data is going to be coming in over the coming weeks and months. But that's, I think, why we're operating out of an abundance of caution, because it is important to relay that the likelihood of severe illness and mortality in children is thankfully very, very low. But we don't know all of the long-term outcomes and sequelae that happen when these children are infected, even if it seems to be asymptomatic. We don't know what underlies that. And so obviously we'll learn a lot more in the coming months. But again, that's why right now, prevention is probably the best thing we can do.
And I'll just add on real quick, long haul doesn't seem to be as common as the multisystem inflammatory syndrome in children, which is a very serious infection and does have long-term ramifications, especially on cardiovascular health.
Okay, thank you. And just a reminder to please submit your questions for a speaker in the Zoom chat. And if you are joining us on Facebook, continue to share your questions via the comment section. So from our media, I'd like to go first to Eric Glasser of WTSP. Please go ahead and unmute yourself and go ahead with your question.
Good morning, everybody. So the question that I put in the queue there that everybody else can look at, and I'll just read it out loud for anybody who wasn't looking at that can hear it. I think it's several press conferences.
Hey, Eric, we can't quite hear you on your audio.
Am I speaking up? Is that better? Check.
That's a little bit better.
Okay, I'm holding the mic up a little bit. Governor DeSantis has cited that the ratio of sick children is remaining close to the same as early.
Eric, your audio is still a little light. I'm going to go ahead and read it to our speakers and the Congresswoman. Governor DeSantis is citing the ratio of sick children as being the same in order to justify school mask policy. Is this accurate? Stats from the AAP seem to suggest a substantial increase, not just in raw numbers, but as a percentage of overall cases. Thank you.
Yeah, so I don't know if I'm going to answer the question in particular, but this is very different than anything we had last year. The Delta variant has made this a game changer in terms of its transmissibility. And even with the data that I presented at the beginning of this, we're seeing that children are making up more and more a higher percentage of all cases. And we're seeing the cases and the hospitalizations go up because community spread has been so high in all age groups. And of course, now once you bring children back into the school setting, again, it's very different from what happened. There was actually a study, a CDC morbidity mortality weekly report with authors from the Florida Department of Health, including the state surgeon general and the state epidemiologist in collaboration with the CDC. And at the time they said, there's not a high likelihood that we're going to get school associated transmission of SARS-CoV-2. And the other thing that they showed in that study, again, out of Florida Department of Health, authors, is that in school districts where they were not implementing mask policies, you had higher incidence. And in school districts that had more children returning in person, you had higher incidence. So they underscored the importance of exactly what Dr. Kennedy was talking about, is a multi-layered mitigation strategy, including hand hygiene and vaccination for those groups that are eligible, and mask wearing, and trying to socially distance, although that's another big thing that's changed, is now schools are back in full capacity. And so the social distancing aspect of it may be very challenging. And so I think just so much is different right now. And I think there is evidence, at least in the past 2 weeks, that children are making up a much higher proportion of all cases that are emerging in Florida.
Great, thank you, Dr. Salemi. Next, we have a question from Sam of WFLA. Go ahead, Sam, unmute yourself and go ahead with your question, please. Oh, Sam does not have audio, so I'm going to read his question as well. Regarding Governor's previous talking points about the proportion of pediatric cases and or hospitalizations remaining stable, is the proportion as important when case numbers continue to rise? Additionally, has the number of pediatric cases confirmed and or hospitalized remained as stable as previously reported?
So I'll address this for a little bit, and I know Dr. Salemi has more of the data, but what I can say is I would love for you to put us out of business as a hospital and not have to take care of sick kids. If you ever talk to a parent who has their child hospitalized for any illness, it is a major time of stress in that family, and it is not something that anybody wants to go through. So we would much rather have everybody stay healthy. but especially at this time when we've seen incredible resurgence of RSV and a lot of other viruses that were pretty much put to sleep during the 2020 school year. It's been a very desperate time for a lot of families, and we've seen increased hospitalizations across the board. So I understand that kids do well with this and most recover, but still we do have a lot of children who are being admitted to the hospital. And when you're going from a handful a week or a handful a day to having several hundred within a whole month, that's a lot of patients that are going through this experience. Missed school days, recovery time, a high economic hardship to the family. There's so many aspects to it. So we get that the children still make up a small proportion of this, but I think you can't just measure it based on their illness. You have to base it on the complete cost it is to the family and those around them.
Yeah, and those are great points. What I would add to that is, I recently got asked by a reporter, how in the world is it that you can say that we're probably going to exceed the all-time death total for COVID-19 when so many people have been vaccinated in Florida? How is that possible? And it's not looking at proportions, it's looking at the absolute numbers. So again, even though I showed you in my presentation, we are shifting the age distribution of hospitalizations and deaths toward younger people, which again, for survivability standpoint, that's a good thing. But we still, for every single age group, have more people hospitalized during the Delta surge. This is from the 80-plus-year-olds all the way down to the pediatric population. We have higher numbers of people ending up in the hospital. And I think we've almost become desensitized to, well, you just go into the hospital and then you go home if you don't die. And it's, if you have to be hospitalized for something, it's very serious. And so when we're seeing record numbers of people hospitalized, we're going to see record numbers of mortality. And so again, whether you talk proportionately about what percentage does the pediatric population make up, that's not what's important to me. It's if we can prevent children from being hospitalized, why not take every opportunity to do that? And, if I know everybody out there agrees that priority number one needs to be getting kids back in schools learning in person. Dr. Kennedy alluded to all of the deleterious effects of not doing that. But we should show them that in our actions, because at best, schools are going to be a mirror for what's happening in our communities. And so the extent to which we can continue to take responsible action and bring community spread of this virus down, the more safe our children will be when they're going back in the school setting.
And I would urge Governor DeSantis to stop downplaying the important public health protocols that protect everyone, but especially our kids as they go back to school. He really should listen to the pediatricians of the world, the American Academy of Pediatrics. Now listen to America's children's hospitals. Some of the best are right here in the Tampa Bay area, especially St. Joseph's Children's Hospital, where they're saying masks are very important. Being in school is vitally important. We've learned that. But what I've heard from the experts is going back to school needs to be coupled with those important public health protocols, wearing a mask, washing hands, being socially distant, trying to get a little bit of airflow, being outside. And really, this is based upon Dr. Salami's information. This is a critical time where it's an all hands on deck moment for all of us to listen to our public health professionals and our pediatricians. I don't think it's that hard, and I think the state of Florida really deserves better leadership.
Okay, Congresswoman, we have more questions from our Facebook feed. We have a question from Desiree. Why can't the president put a mask mandate in place in high transmission areas for kids ages 5 through 12?
I think the CDC, they have recommended masks in schools and in areas where you have large gatherings of people. What do you say, Dr. Salami, looking at that? I think CDC has been reluctant to do kind of across the board kind of mandates and really rely on local leaders and leaders in the state. But here we have a governor that has been kind of denigrating that as a public health protocol, it's kind of a sticky wicket.
So right now, the CDC does recommend masks for everyone indoors in schools, including visitors to the schools, especially in areas of high transmission, where if you think about Florida right now, that's pretty much everywhere. And I want to underscore just one example. Obviously, we can get into, studies on masks are challenging and complex. In fact, a lot of people say, why aren't there randomized clinical trials, on mask wearing? And it's because to do a randomized clinical trial, to randomize people to wear a mask or not, that's something that would not have what they call clinical equipoise. We don't think it's actually, something that is a moral thing to do, to have people not wear a mask, because there is experimental and epidemiological evidence that they are one of the strategies. They are not foolproof. They are not perfect. But let me give you a recent CDC case study for why we need to layer all of these things that we're talking about: mask wearing, vaccinate all eligible people of vaccine eligible age, quarantine and isolation, screen testing, ventilation, filtration, hand hygiene. Don't go to school if you're sick. This will underscore why we try and layer all of those things. So there was a study that just came out in Marin County, California. That's a very wealthy county with very high vaccination rates. If you looked at their classrooms in this particular school that I'm talking about, they had great ventilation. They had opened the doors, opened the windows. They had a HEPA filter at the front of the classroom. They had universal masking compliance among the students and the teachers, and physical separation. So you're doing everything right. Yet a confluence of factors ended up resulting in 26 infections that occurred in that classroom, in other classrooms, and went back home. And here's what happened. First of all, the teacher chose not to be fully vaccinated. And so you had an unvaccinated teacher who came to work with symptoms. It just seemed like allergy-related symptoms, but she ended up still coming for 2 days with those symptoms. So that's kind of no-no number two. And then when she would read to her children, she would remove her mask. So even though they were doing so many things right, because of the massive transmissibility of Delta, it ended up infecting her students. And why you know that it was this is if you look at the first 2 rows of children sitting right next to the teacher, there was what we call an 80% attack rate, which means 80% of the students in the first 2 rows ended up getting infected, and only 28% of the children in rows 3 through 5 got infected. So again, that's why we say one of these strategies alone is not perfect. We want to do as many of these things as we can that decreases the likelihood that when our children are back in schools, getting all of the benefits of in-person learning, they're not susceptible to getting infected. And again, it's not just about their health. It's also, I don't think I can talk to a parent out there that hasn't been impacted, myself included, with the quarantining that happens. When there's a positive case, they're taking proactive, options to say, go quarantine. My son has only been able to attend, I think now, 5 days of school in the first 17 or 18 that have been offered due to quarantining. And so that's why we're trying to preach, let's do as many things as we can, especially when transmission of the virus is so high. That's the best way to keep our children safe, in my opinion.
Great, thank you, Dr. Salemi. We have another question from our Facebook feed. This is from Jessica. Can anything be done on a state level to protect children in Hillsborough County? Hillsborough County School Board is not doing enough to mitigate. My child is immune compromised and did homeschool for 1 year. He is on a 504 plan. Does he deserve a half education, or does he deserve to go to school and be put at risk? If we can prevent this, why not err on the side of caution?
Well, I agree with you, Jessica, and God bless you, taking good care of your child, wanting your child to have everything we all expect as parents, for them to be healthy and well, and to get a high quality education in a safe and caring school. So I think the state of Florida can do a lot better. I think it's been very unfortunate and wrong for the state of Florida Board of Education to threaten school districts that are simply following public health experts on requiring masks in the middle of this very contagious Delta variant, to threaten them, to say we're going to withhold salaries. is wrong. And fortunately, a judge last week found that the State Board of Education and the governor cannot interfere with that, but there are going to be appeals, but at least they have time now, these school districts, to institute mask requirements during this very perilous time in the pandemic. And then the state of Florida also, unfortunately, is withholding a lot of our federal COVID emergency aid that we passed in the Congress under the American Rescue Plan and the previous CARES Act. Those monies were intended to be provided to local school districts, schools, educators, to make sure that they have the proper ventilation, they have the HEPA filters, that everyone has a mask, that they are able to spread out the classrooms as needed. So the slow walking of those emergency aid funds has been very damaging, and we have been on the warpath to get Governor DeSantis and the state of Florida to get those emergency funds down to the local level. And fortunately, the Biden administration, the Secretary of Education, said that for school boards that are instituting mask requirements for the time being, that if their salaries are withheld, that they'll have their back and try to make that up. But I don't think that's what it's about. It's not about the salaries. And I think a lot of those school board members all across the state have been very brave and courageous to say we're going to keep the best interest of children and students at heart. That comes first, notwithstanding the bullying from the state level.
Okay, Congresswoman, that was our last question for today. So that wraps up our question and answer session. Congresswoman, do you have any closing remarks?
I do. I want to thank Dr. Salemi and Dr. Kennedy for everything that they are doing. You all have been terrific today, but really you're helping to educate the public, keep us apprised on what's happening throughout the community, and particularly for our kids and in our children's hospitals. And I'll just reiterate the strong message from America's Children's Hospitals that was issued just this week. Please stand to help protect our kids right now, and together we can keep our kids safer. They need our support, our care, our commitment to their future, and they need it now. So thanks again for joining us today, and please stay safe.
All right. Thank you, everyone. Have a great day.